We are joined now by Dr. Shelley Friedman, a transplant surgeon and an International Society of Hair Restoration Surgeons specialist. You are with Scottsdale Institute for Cosmetic Dermatology. Whew, I got it all out. Thank you so much for being here.
Thank you for having me.
Hair loss, something that certainly, I guess, causes a lot of anxiety with people, both men and women. And I think we typically think male pattern baldness, but this is a women's issue as well.
Definitely. There's 40 million men who suffer from hair loss. There's 30 million women.
Wow.
30% of all women have some form of hair loss.
And there's, for some reason, there's a sort of a misconception that there are not a lot of options out there for both men and women. There
are more options for men than there are for women. But for women, we have a couple of things. The newest thing is the laser.
I'm fascinated by this because this looks just like a hairbrush.
It looks like a hairbrush, but when you turn it on, it has 6 diodes that are at a certain wavelength that when you use it on your hair, you brush it 20 minutes every other day over your scalp. It will give you fuller hair. Your hair will look thicker, fuller, shinier hair.
Really?
It can actually reverse the pattern of hair loss. Now, this is wonderful for women.
Okay.
This is phenomenal for women. For men, we can use Propecia to stop hair loss. For women, we use this.
And is that because it would result in hair in unwanted places if you took the Propecia?
No, actually, it just doesn't work.
Oh, you're
kidding.
kidding.
Plus, it could cause birth defects.
Okay.
So women can't use Propecia. They can use Rogaine. Rogaine is another thing that we can use. It's not as effective as the laser. It's not as effective as hair transplants.
Okay.
Hair transplants can be used for both men and women. So those are our options available today.
So this is something for use at home?
Yes.
Okay.
This they can use at home, but in the office we have a unit that is a big unit with 107 diodes, as you're seeing now. Those 107 diodes are a lot more, obviously, than these 6. You get much more power, and your growth is much faster.
Every couple of days, someone is coming in and talking about laser being a miracle for something, whether it's skincare or your eyes. What is it that it's actually doing?
It actually is increasing the protein synthesis, which means it's increasing the metabolic rate inside the follicle.
Okay.
It's nourishing the follicle and just making it very, very healthy. So this is really the biggest thing. The laser has been a godsend for women. And what's really good now is we just placed 2 of the big units in Dolce salons in Arrowhead and Chandler. And the first 100 patients that come to us to talk about this and undergo laser treatment, Dolce is giving them a $25 gift certificate.
Great.
So this is going to be available not only in our office in Scottsdale, but in Arrowhead and also in Chandler.
Last question, as we're just about out of time. This is only dealing with the spots where you did have hair before, or if you've always had thin hair, or always had a cowlick, or...
Wherever you have hair, if you do this, then it will start to grow. One thing I did want to tell you is that it's very exciting. For men, we now have a genetic test that tests the DNA that will tell us whether or not a man is going to lose his hair by the age of 40.
Really? And then you start the preventative steps early on.
Exactly. And that's available at our office, and it's the first time it's available in Phoenix. But it's just a swab of the inside of your mouth. We send it off, and in 3 to 4 weeks we know if somebody is at high risk or low risk to develop hair loss.
Okay, and then you start setting up a strategy.
Exactly.
Well, doctor, thank you so much for joining us. We're going to put all the information on our hotline and website so that you can check out your options and contact the Scottsdale Institute for Cosmetic Dermatology. Thank you very much for your time.